Habitual dislocation of patella. Habitual dislocation of patella means patella dislocates laterally every time when the knee is flexed and relocates when the knee extends spontaneously. So whenever the individual flex the knee joint, there is a dislocation of the patella and it relocates spontaneously when the individual extends the knee joint. This is an uncommon dislocation and often we see this in childhood, especially early childhood. Now, what are the causes? The first cause is the underlying defects which are very similar to those we have seen in the recurrent dislocation like the patella alta, genu valgum, increased QR angle, a high lying patella, all these causes. Now, other than that, shortened quadricep is one of the reasons, especially the vastus lateralis component of quadricep. So, when there is a shortened vastus lateralis component of quadricep, it will result into an abnormal pull on the patella. As you can see here, this is the vastus lateralis. If it is shortened, it will pull the patella laterally when the knee is flexed. Now, why there is a shortening of vastus lateralis? There are studies which shows that intramuscular injections often given to the children during infancy. Now, during infancy, due to the intramuscular injections in this region, in the region of vastus lateralis, there is a fibrosis of tissues which will result into the shortened quadricep, especially the vastus lateralis component. Now, sometimes, other than that, there is an abnormal band of fibrous tissues which tease either the vastus lateralis muscle with the IT tract or the IT band. So, what about the treatment? If no treatment is given, then the patella dislocates permanently. So, treatment is very important. So, treatment includes the release of the tight structures on the lateral side and repair of the lax structures on the medial side. Now, this is how it is done. A vertical midline skin incision is given. Now, lateral structures are released which are tight and the repairing on the structures which are present on the medial side is done, especially the capsular plication. Now, this capsular plication is a surgical procedure that tightens the capsules around the joint and treat the instability, pain and the conditions similar to this. An additional recheck-in mechanism of some sort of created to prevent redislocation. For this, semitendinosus tendon is used, which is used in such a way that it prevents the redislocation. So this is all about the treatment of habitual dislocation of patella, the release of tight structures on the lateral side, repair of the lax structure on the medial side, and check-in mechanism with the help of semitendinosus muscle. I hope you like the video. In case if you like the video, do like, share and subscribe the channel.